Look East.
The row over the reorganisation of mental health services in Norfolk and Suffolk deepened today, with one union demanding the changes are halted immediately. Unison has raised a formal grievance claiming changes are leading to unsafe staffing levels, unmanageable workloads and poor outcomes for patients. The Norfolk and Suffolk NHS Foundation Trust is having to make £40 million in cuts and axes 400 staff. Last month, Norfolk County Council took back the care of adults with mental health issues after criticism of the Trust. Well, earlier I spoke to Emma Corlett from Unison and asked her to spell out her concerns.
There's a number of things, from unsafe staffing levels on wards, which can mean it's difficult getting patients out and about off the wards, getting them access to fresh air. In the community, we have patients who should have an allocated care coordinator. It's been accepted that they have significant mental health needs. There's currently no staff available to allocate, so they're sat there waiting to be allocated a care coordinator.
It's a very complicated area of medicine. I mean, the Trust would say that they also care, but they are trying to deal with an increased workload with far less money, 20% cut in NHS spending over 4 years.
That's exactly what we're asking them to say. Unfortunately, what the Trust have been saying and agreeing with the Commissioners is that actually they can deliver what we used to deliver on the same amount of funding. And what we're saying is now you need to listen to our safety concerns. Now these changes have been implemented, we clearly cannot safely deliver care to the same number of people and that reduction of funding.
So if you are raising a formal grievance, what does that mean? What can you do next?
We've asked for very clear action for the Trust, that is to set a timetable of meaningful negotiations with us. We want them to review the changes that they have implemented so far, evaluate them for the impacts on the quality of care and the safety of care, and once we've got the results of the evaluation of the changes that they've made to date, then decide what course of action the Trust should take next.
Emma Corlett, thank you very much indeed.
Thank you.
Well, earlier the Trust issued a statement responding to Unison's criticism. We acknowledge that there are areas of improvement to be made, but are disappointed that they have resorted to this approach rather than engage in discussions with the management of the Trust. We reject any suggestion that the services we provide are unsafe. A Cambridgeshire gang master